Thank you for joining ComForCare and At Your Side Home Care for this informative Dementia-Wise webinar, which reviews sundowning and how to prevent and manage it when present. Please let me welcome our host, Director of Special Populations, Dr. Deborah Beer.
So glad you could make it for today's talk. We'll discuss what sundowning is and why it happens. We'll do an overview of preventing and managing sundown and 5 approaches to prevent and manage sundowning. And then we'll talk about resources in your local community. But first I want to say that this webinar is for educational purposes only, and the information provided is not intended to be diagnostic or serve as a substitute for actual medical advice. If you have concerns about your or your loved one's health or diagnosis, please seek out a licensed medical professional. I want to clarify 2 terms that are often confused, and those are Alzheimer's and dementia. Dementia is a group of symptoms involving cognitive impairment, and there are many, many different kinds of dementia, including Alzheimer's disease. It's only one type of dementia, but it's the one that we hear most frequently because it's the most frequently diagnosed. All Alzheimer's is dementia, but not all dementia is Alzheimer's. Today, when I say dementia, I mean specifically any particular kind. When I say Alzheimer's, I mean Alzheimer's disease. Let's look at what sundowning is and why it happens. Sundowning is also called sundowners, sundowning syndrome, nocturnal delirium, or late-day confusion. And it involves behaviors that occur in some older adults, whether they have dementia or not, starting about the time of sunset or before sunset. And this can include confusion, anxiety, agitation, aggression, strong displays of emotion, big emotionality, very dramatic, pacing, wandering, or resistance to redirection. Now, not everyone who has dementia sundowns, and not everyone who sundowns all the time. So we don't really know what causes sundowning, but there are factors that we understand that increase its risk. For example, undermanaged pain or unrecognized pain, severe constipation, problems with nourishment, being on too many on a lot of medications, because it's likely the more medications we're on, the more side effects and interactions we have. The presence of an infection, a noisy or disruptive sleeping environment, or physical or emotional exhaustion at the end of the day. Also, an upset internal body clock or some kind of sleep disturbance, which is very common with dementia. Confusion due to lower light and the lengthening of shadows as the sun sets, and more. Let's look at the general approach to preventing and managing sundowning. Now, sundowning is not unusual with dementia, and these behaviors, though, can be really upsetting for the people who go through sundowning, including their families and caregivers. The dementia-wise standard of care is always to try to prevent or reduce difficult dementia behavior. Preventing behavior before it begins is our highest goal. Sometimes we can prevent or reduce sundowning. Sometimes we can't, but we can change how troubled we feel about it and how we respond to the behaviors. So the first step is to establish a baseline. Each person's sundowning is quite different, so we have to understand what any particular individual's sundowning is like. So it helps to write a written log and establish the baseline. How often do they sundown? What is it like? What was going on before the sundowning start? And observe them for any kind of patterns that begin to emerge. And I would observe them for at least 4 sundowning episodes. If someone sundowns about twice a week, I would go for 2 weeks. It's helpful to learn as many methods as possible to try to reduce the sundowning, and then try only one method at a time to see what actually works. And I think, again, you wanted to go 3 or 4 episodes of sundowning before you finish assessing whether a particular intervention is helpful. If one method helps, keep that. And if you want to try others to further reduce or prevent sundowning, then add them again one at a time. If one method doesn't help, don't give up, drop it, and try another one. I want you to make sure whichever method you're trying and however you're managing sundowning is that we not argue with someone who has dementia while they're sundowning or at any other time, but especially while they're sundowning. Arguing does not help. Arguments cannot be won with someone with dementia because they won't remember it, and you'll just have to make the same argument again. Don't try to use logic to relieve their confusion because that also doesn't work with a confused person. It's important not to yell at them or tell them to stop that sundowning behavior. It's very tempting and totally understandable because often by the end of the day, caregivers have just about had it and are at the end of their ropes. But it does not help to yell at them or tell them to stop the behavior because they don't understand what you're referring to. Important not to act angry, disapproving, or punishing, including the next day, because they're not going to remember what happened. So any of the reactions that make the person with dementia more unhappy, more out of control, are going to make you more unhappy as well, and it's not going to help the situation. Now, sometimes they give antipsychotic medications for sundowning, and that really is a last resort. It's not a first resort. It's often treated like a first resort, but it should be a last resort, and that's only if there's imminent danger to the person or to someone else. So I want you to, in looking at and judging the progress, not use the definition of progress as there's no more sundowning ever. We need to look at lesser levels to understand if one of the methods that you're going to be using is successful. We would love it if there was no sundowning. It doesn't always happen. So we want to look at lower levels of success. For example, it's happening less often, or it's happening less intensely, or the caregiver feels less stressed, or the person is more peaceful, is sleeping better, just general improvement in their condition. And we can't tell which method is going to work, and we can't tell which of the symptoms are going to be relieved first. So observation is really important. Let's look at 5 approaches to prevent and manage sundowning. Now, these 5 are not the only ones possible, but they're a really good place to start. If you find other methods to prevent and reduce sundowning, you would add them in the same way, one at a time, and assess them for about 4 or so episodes. It's really important that no matter what you're doing, that the caregiver and other people around the person who's sundowning remain calm. Because people with dementia take their cues from people around them. So if we come in and we're tense and we go, oh, it's sundowning time, it's going to be terrible, and that's the body language we have, the person with dementia is going to see, oh, there's something bad going on, and it's going to make their behavior more difficult. So always remain upbeat and positive, even if you have to fake it. The person, then we will see whether or not they're actually sundowning or just reflecting off of your emotions. So the first one is to use best dementia care techniques all day long. Learning as many as you can, listen to more of the Dementia Wise webinars to learn as many as possible, and then treat them in a way where they continually feel safe, cared for, understood, and are engaged in positive activities. And these strategies alone will prevent or reduce difficult dementia behavior throughout the day. Our goal here is to get people in a better mood, in a better place before sundowning starts, so that they're not already overwrought and then we're putting sundowning on top of this. These are not techniques that are often taught. They're not often used, but they're very successful. And I hope you'll watch and learn more about Dementia Wise. The consistent use of best practices throughout the day sometimes can help prevent or reduce sundowning. The second method is to improve the quality of their sleep. Many people with dementia have really highly disturbed patterns of sleep. Sometimes that starts many years before the other symptoms of dementia come around, and as a result, they're tired towards the end of the day. Many of us are tired around sundown time. So it's not surprising that someone who is struggling with dementia might be tired. A nap in the afternoon might help them prevent or reduce sundowning. And alternately, there are some people who are napping too much and they can't get to sleep at night because they've slept so much during the day. So in that case, you might want to shorten or reduce naps during the day so that they can get a better night's sleep. And then you want to apply general good sleep hygiene, such as optimizing the type and amount of light at night, reducing noise, reducing activity, no caffeine or chocolate in the afternoon or the evening, just so that we can get a better night's sleep. Sometimes that will help with sundowning. The third method is to try to increase physical activity, particularly in someone who is very sedentary and has very little activity. We want to help that person engage in a way that's safe for them, that they tolerate given their strength, and we want to do this in the morning and mid-afternoon. We don't want to do this too close to sundowning. This is a great time if there are physical therapy exercises that need to be done on a regular basis. Is a great way to get them in and also try to prevent or reduce sundowning. And we know that being more active can often improve sleep patterns. So it's beneficial in so many different ways. The fourth method is looking at whether or not someone else is the trigger for the sundowning, someone who is not the person with dementia, and that might include you as the caregiver. Anyone who is present needs to be looking to reducing their triggering behavior so that they're not making the behaviors of sundowning worse. A lot of dementia behavior that's difficult is actually triggered by caregivers, and we certainly don't do it because we like to do that. It's inadvertent. It's because we're not aware of best care practices. So caregivers, family, friends need to be further educated in best care strategies so that they're not triggering difficult behavior. And as we're looking at the pattern of sundowning, look at who is present and how that relates to days that there are sundowning. If the people who are triggers develop better care skills, they might still be able to be present during sundowning without triggering them, without triggering difficult behavior. But it may also be that those people simply shouldn't be there during sundowning. And the fifth way what we're going to look at is increasing meaningful activities. Boredom and lack of engagement and stimulation is often the mother of difficult dementia behaviors. So you want to be starting and supervising really loved activities throughout the day, not just around sundowning, but throughout the day, and especially before sundowning. Keep in mind that when there's dementia, activities may not be a good idea beyond 20 minutes at a time. The attention span may not be good. Maybe 30 minutes if they're really engaged and not advanced in their dementia, but 20 minutes is probably a good goal, and shorter if things don't go well. And meaningful activities can include any kind of care task customized for that person's preferences and pleasure, and encourages them to participate. So a shower or a meal or getting dressed in a way that really engages that person's personality and preferences could be a meaningful activity. So for additional resources in your local area, if you're a family member with someone with dementia or a healthcare professional who's managing dementia patients, dementia care, caregivers, or families, our local offices can assist you with strategies and solutions for your dementia care challenges. I encourage you to contact your local ComForCare or At Your Side office for information about our dementia services. And if you'd like to know more about Dementia Wise and learn more best care practices, look for Dementia Wise presentations and family caregiver support groups in your area. And you can also sign up for free information about dementia care and other topics by visiting ComForCare.com or AtYourSideHomeCare.com. Thank you so much for joining us.